Good morning, everyone, and welcome to our third and final day of the International Rare Disease Showcase. Thanks, everyone, for joining us. For those in the UK, thanks for the early start. For those in the rest of the world, just thanks. I'm going to start the day off by saying a quick thank you to our sponsors. Without these, we couldn't have made this event happen, and we're so grateful for them for their support. So we have our corporate sponsor, Helix, our gold sponsor, Pulse InfoFrame, Bionicle EMAS, and Apparito. We also have our silver sponsor, Yusuf Pharma, our bronze sponsors, Gilead, PTC Therapeutics, Roche, and Rhythm. And thank you to the Community Fund as well. So we have a great session for you today. It's advancing the rare disease progress in the Asia Pacific region. And as you all know, we've already had dedicated sessions in the showcase so far to the rare disease landscape in Africa and the Americas. And today we're just really excited to focus on the Asia Pacific region. We've got some really interesting talks for you. So I'm Hannah. I'm the projects officer here at Beacon, and also hosting this session, we have Rick Thompson. I'm sure you've seen him around as well. He is our CEO, so he'll probably be popping in and out a bit later. So in this session, we will explore how the rare disease landscapes into the diverse Asia Pacific region, the drive from the patient community to deliver change, and the huge potential for future development. And I'm really excited to introduce our speakers today. We have Dehane Wong Riga, the president of APARDO, and she's got a pre-recorded presentation for us this morning. We also have Raj, the principal consultant at Manifest, Swapna, head of strategic partnerships for the Organization for Rare Diseases India, Sue White, a clinical geneticist and Murdoch Children's Research at Murdoch Children's Research Institute in Australia, and Lisa Foster, the chief executive of Rare Disorders New Zealand. So first up, we have the pre-record from Dehane. So I'm just going to stop sharing my screen. Yeah, so I know you've seen Dehane a little bit already, but now we've got a pre-record discussing her work in APARDO.
Hello, and thank you very much for the opportunity to be here to talk to you about the Asia Pacific Alliance of Rare Disease Organizations. My name is Dehane Wong Riga, and I have the privilege of serving as the president of APARDO. Share to you a little bit about what the vision and mission of APARDO is, and also some of the things that we've been doing, and hopefully have a real invitation for you to join us as we move forward. So this is the board of directors. As you can see, it's a broad representation in terms of membership, including representation from Australia, from New Zealand, Singapore, China, Taiwan, and Japan, and Hong Kong. So this is our board of directors, many of whom with us for a good number of years. This is kind of our current status. We have 29 member organizations across 15 countries. And as you can see, we've got different countries have representation here, and no one country dominates, so good number across from Australia and New Zealand as well. This is just a listing of them. Some of them are nationalized, some of them are disease-specific alliances, and some of them are disease-specific groups within their own countries, but it crosses a whole array of different diseases. These are some of our partner organizations. Well, these are our partner organizations, and we've been really grateful to them for their participation with us over the years. Some of them have been with us since the very beginning and really helped to support not only the activities that we do, but also to support our ongoing ability to do the kinds of foundational outreach. So who is APARDO? Well, Asian Pacific Alliance of Rare Disease Organizations, where our vision is that anybody who's living with a rare disease in the Asia Pacific region should have the same opportunities. And as we know, it's quite an array of countries with very different health systems, very different economics. But no matter where you are, no matter what country you're in, you should have the opportunity to achieve the very best that you can in terms of having access to the kinds of care, treatment, and support. APARTO was founded in 2015. It had been meeting informally for a good number of years before that. It is, in fact, patient-led rare disease organizations, though many of them are multi-stakeholder organizations, which means we do want to and we intend to work across all stakeholders. The objectives are to kind of fairly straightforward as an alliance to facilitate and support collaborations, to identify, share, and promote implementation of best practices, to provide an effective unified regional voice, to serve as a network for capacity building, information sharing, skills development, and to really continue to have that focus on achieving meaningful impacts in partnership with other stakeholders. So always working across different stakeholders across the region. These are one of the important things to know is that APARTO is a regional member of the Rare Diseases International. So a lot of what we do is informed by RDI. It's also facilitated by the deliberate kinds of activities that RDI does, including their capacity building activities and also their work at a global level. It also brings us into some of the global organizations so we can effectively build on the many kinds of initiatives and skills that they're doing, skills development they're doing, and to make sure that our individual members have access to activities that RDI is sponsoring. So anybody who's a member of APARTO gets automatic access to what is happening at the global level. Also, APARTO works in, as we said, brings our member organizations into the opportunity to working with the global initiatives. RDI is a partnership with WHO and has a number of global projects that are going on, including an ongoing project to develop a global network of centers of care and expertise. And many of the APARTO members have been involved in those consultations and will be going forward. Another project that the RDI has with regard to the WHO is actually promoting equitable access and using the list of essential medicines for rare diseases, both from the WHO, but also a new one that we've been putting together with the International Research Consortium on Rare Diseases to advance access by looking at the barriers, by coming up with solutions, hopefully by having some model projects that we will be able to use to actually look at all the what can be done, all the needs in terms of getting rare diseases into a specific jurisdiction. Our APARTO has a direct membership with the International Research Consortium on Rare Diseases, but also the International Rare Disease Research Consortium, but also then is a member of the member organizations who are not directly involved in IRDIC can also take part in the work that IRDIC's doing, join the committees, join the working groups, take part in the capacity building activities. There's a new resource that's being developed by RDI, and again, the member organizations within APARTO will have an opportunity to share in that. And also then because RDI and APARTO are actively involved in the Asia Pacific Economic Coordination Rare Disease Network, we are actually able then to take advantage of the work that's being done there, to actually take advantage of the countries, the national economies that are actually promoting rare diseases. This is just a snapshot of some of the activities that we did, and we've had a conference every year since 2015. The last 2 years, 2020, 2021, were virtual conferences, but we were able to, in fact, have this past year on 14th and 15th, 2 days of very, very, I think, intensive and exciting conferences that brought together a whole host of presenters and brought together a lot of groups in terms of their discussions and sharing of what it is that we're doing in their region. So some of it in terms of looking at the global environment, some of it looking at very specific issues, including the essential medicines list. Big thing that we have been able to do this year is to really talk about, what happens in terms of the challenges for rare diseases across the region. What is the advances that are taking place? What needs to take place in order for patients to have better access to some of the universal healthcare global initiatives, and also to some of the medicines development initiatives. So this just gives you a snapshot of what we've done. All the member organizations are able to take part. We had hundreds of people that attended over those 2 days in the various sessions, and we were really delighted in terms of the range of participants that we have, including member organizations, including industry, including the researchers and the and clinicians, medical experts. So really, in the most part, really having the opportunity to have them in dialogue and in a workshop form. So this was extremely valuable. We had one that we're hoping to expand on a lot this coming year, and that is to focus on genetics and genomics as certainly in a really important area that's advancing both in terms of diagnostics, but also in terms of treatment. So trying to keep an eye on how we can keep members in our and the Asia Pacific area intimately involved in these new technologies, in these new emerging areas that are going to be so important in terms of improving the diagnostics and the treatment and care for rare diseases. I just wanted to give you a picture. We will just walk through it. This is the different sessions that we have and the range of experts that you might see. Some of these are international representatives, pharma representatives. This is some of the other areas that we had in terms of people that were in that APAC region, some of our own members, as well as, of course, again, some experts at Bill Gall, who is my co-lead in the project on the essential medicines list. Bill is the with the National Institutes of Health in the US, and is also head of the Undiagnosed Diseases Initiative, International Initiative, and just recently got the Black Pearl Award for his lifetime advocacy work in rare diseases. This is again some of the other sessions that we have, leveraging universal healthcare. Had some of our own people really being able to talk about how do we use the toolkit that has been developed, how do we apply it in terms of our areas. One of my Carmencita Padilla, doctor from Philippines, who's done so much work in terms of newborn screening, really delighted to have that broad range of participation there. And again, being able to talk about a whole new area, which we hope will be a big focus for this coming year, and that is mental health and mental wellness, and the impact it has and the need to take much more deliberate action. We're delighted to have had Anders Olsson, who's actually the head of Agrenska, which is in fact a facility in Sweden that is set up for families, patients, as not just a respite, but actually as a facility that is devoted to quality of life for rare diseases, and looking at whether or not that can be a model that can be brought into other countries. And it's actually being brought into other countries. And then also having the opportunity to talk about what's the role of patients in terms of research and development. And that actually was a great conversation. And how can we get more patients in the Asia Pacific area to be much more directly involved in drug research and development? This was a great opportunity, in having two of the people from Pfizer who actually helped present and understand the opportunities within the industry. And then also then what are we doing in terms of the genetics and genomics? So that was, again, a very important opportunity to look at, as I said, a hugely emerging area there, and why it's so important that Asia Pacific is, up to speed, up to timing in terms of what's happening in this really important field. Again, just wanted to highlight again, the challenges we know going forward is that, in fact, we're still going to be having to deal with COVID. But, the question is, how do we keep advancing rare diseases? And we know in different countries, some has done better than the others. And just wanted to put out here the notion that, look, there could be different worlds that we're going to have to deal with, where there may be that we'll be back to where we were before, back to the future. It may be that we'll have to see this pandemic play out for a few more years as a pandemic, but we cannot stop advancing rare diseases. We cannot stop providing access to diagnosis and treatments for patients with rare diseases, or we might look at the pandemic as becoming an endemic, and we'll learn how to live alongside of it. Again, making sure that the resources that are going to be available for health services and the investment into it also going into rare diseases. So this is kind of what we're looking at in terms of the landscape. And, many of you may know is that, Asia Pacific region has about almost 2/3 of all the patients who live with rare diseases right in the Asia Pacific region. So this is doubly important for us in terms of having strategies that can deal effectively with it. We've got about 200, 6,000, 7,000, that are rare diseases. And so, more that are added every year. About 4,000 we can actually identify. We know what the genetic cause of them is, but we don't actually able to obviously provide the care and treatment to all of them. What we do know is very strikingly 70% of pediatric. This is something that surprised me a great deal. More than 80% of rare diseases, affect fewer than 1 in 1 million persons. This is a real challenge when we talk about these ultra rare diseases, how to diagnose them, how to provide the appropriate kinds of care, but as importantly, where are the treatments coming, how we're going to make them, not only research them, but how to make them available. And this is, again, something that's quite interesting, is that most of the rare disease population actually is huddled into about 4% of the most common rare diseases. So there's some real interesting challenges in terms of not only, kind of how do we continue to serve this, which is a fairly large population, but how do we serve the others that are really sitting on the margins there. What we do know is that there will also be more and more diseases that will be coming into this space as we are able to identify gene mutations that might identify and recognize only a subset of more common diseases, mostly cancers. So disparities and inequities across the regions. Asia Pacific is probably one of those regions where you can see the most inequalities, inequities, everything from the big countries that may have lots of resources, countries that have very well-developed healthcare systems, have actually invested a great deal in terms of centers and in terms of diagnostics, to countries where the economies may be much more depressed, maybe much farther behind in terms of providing for not only health services, but all the other socioeconomic services. So this is a real challenge for us, all of us, is how do we work as a region, recognizing that there are such disparities, inequalities across the region, and yet we want to make sure that we can bring everyone along. Certainly some of the global policies around universal health coverage, some of the new Declaration on Rare Diseases is an opportunity to bring everybody into those initiatives. Also, some of the innovative technologies, including telehealth, including this collaborative global networks, including new technologies for genetic testing and genomic sequencing, certainly could help in terms of being able to provide more assistance, but also could have the risk of creating more disparities unless we're very deliberate about it. So that's one of the goals around the Asia Pacific region, and certainly one of the goals of BAPARDO. How do we recognize and address the disparities so that we don't leave anyone behind? So these are very quickly our activities that are planned for this coming year, first quarter. Along with our regular business work, we want to have a workshop on universal health coverage and the Universal Declaration. How can you, as a patient organization, a multi-stakeholder group, apply these global frameworks at a local level? What can you expect? How can you use them to leverage access to policies locally or to services locally? We want to have a roundtable discussion on the essential medicines and what are the barriers to access, and maybe be able to use that as a springboard to having a larger workshop that we will be able to bring some of the solutions into for all stakeholders. So quarter one, a closed one. Quarter two, we want to be able to have a broader workshop. We also want to start to focus on genomics and gene therapy, and maybe bringing in, focus on 2 of the countries that are doing maybe a lot in terms of the genetics, genomics testing, and also the access to therapies. The third quarter, then, we want to focus on, as I bring in a workshop on mental health, which I think will be a very, really worthwhile topic, and hopefully bring in a lot of people that are already doing work in that area, coming back into the genetics and looking at newborn screening. And then we also want to be able to have, in this case, a workshop on coming back to in the fourth quarter, what are the gene therapies, what are emerging therapies there, and to have an annual conference. We will have that again probably toward the end of the year. And hopefully by that time, it could actually be an in-person meeting. 2 other things that we've got are going to be ongoing. That is a resource library. So we want to collect data, videos from the patient organizations that we can share, including best practice, including testimonies, including the kind of activities that you're doing, and also continue with the newsletter that we have. So these are things that we're moving forward on for this year as a springboard towards really activating the collectivity around the region. Thank you very much. Really, these are two, check our website out to find out how you can join the APARDO, how you can take part in our activities, and certainly do feel free to contact me if there are very specific questions you've got. Thank you.
Okay, I want to say a massive thank you to Doreen for that pre-record. I'm not sure if people have been watching the last few days, but that's actually Doreen's third appearance at our showcase. She is a woman that wears a lot of hats, and we really appreciate her coming, giving us that pre-record, talking about the work that that they're all doing in Impardo. So up next, we have Rajikanath from the principal consultant at Manifest, and he will be discussing the progress made in rare diseases in the Southeast Asia region. So Raja, welcome you.
Hi, Hannah.
Hi.
Hi. Hi, everyone. Thank you very much for the opportunity. So in my 20 years of experience, I've had the opportunity and been blessed to be able to work with the rare disease community, not just in Singapore, but Malaysia, Thailand, Indonesia, Philippines, as well as Vietnam. Now, taking a leaf from Derhan's presentation earlier on, I think what we need to understand is how does ASEAN Asia operate? In the first place, I think with rare diseases, there are many challenges that we face from the start. One is the culturally self-limiting with the many taboos, like, when you look at a country like Thailand, you've got the rural citizens and you've got the citizens that are actually in the city. And they are very different access to treatment at this point of time. And culturally, they are also very different. The way they think about rare disease and the way they actually think if diagnostics are necessary and even treatment is necessary. Next is the community stigma, the community acceptance of the disease by itself adds to the load of trying to manage rare diseases. And on top of that, the different stages of development between the neighboring countries. Of course, a huge portion here would be the poverty, which leads to the accessibility issues of medication, as well as even information. The illiteracy just adds on to the whole burden now. With the health literacy being so poor, I think patients are not aware of the diagnostics in place, where they can go to for help, what they can do. Now, the next problem comes to the multi-health care system syndrome, where I think what happens is we have multiple healthcare systems that operate, one on education, one on the Ministry of Health, and funding becomes an issue there as well. And I think now with patient groups, I think being a concerted effort, being one voice, I think helps a lot when we deal with rare diseases. But in certain countries, I think what we see is there are multi-patient groups. And with that, I think the efforts become, it becomes fractious sometimes. It also becomes disintegrated. So I think one is what we've seen on the ground while working with them, capacity as well as capability, was to bring them together. Now, I think the next step would be what next and how can we then advance? But what actually posed a further challenge was the short-term partnerships that actually most of the patient groups had. The short-term partnerships that did not last anywhere beyond 12 months. And that actually put a hindrance to many of the projects. That leads to the change in partner KPIs as well. And of course, the last two would be non-patient involved systems and processes. So on this point, I must say that there have been steps. Things have really improved. There are new points of engagement for patients to be involved. And of course, with some countries in the region, patient groups are still not registered as an entity of their own. So all of these things add up to the burden, of course. So now let us take this forward to see what has actually happened. And in the last 10 years, many things have changed. Let's start up north in Vietnam. So I think there's a patient support group that's formed there. We had a chance to work with them in a hospital with RD department in Hanoi, aggressive diagnostics, awareness campaigns, and patient outreach. So that's a really good step for Vietnam. Coming down to Thailand, patient advocacy group takes the lead there with Thailand Foundation for Rare Diseases. What they did was to collect data and to aid discussions. That put Thailand on the map in the forefront in 2020. 24 rare diseases were included in the universal care system. Right now, but we do much work with them. They are working on new inclusions as well. Next, we come down to Philippines. Data was collected. There was a rare disease bill passed. To date, many of the patient groups, physicians are still engaging with government for funding. Indonesia, a patient advocacy group has been formed. Awareness campaigns, patient outreach is still happening. There was an impact study that they wanted to put forth so that they could actually explain the burden of the disease and the journey of the patient groups. With Malaysia, there is a foundation that's been set up that actually puts together all 3 rare disease groups there, and a rare disease working committee established to actually discuss the next framework for rare diseases in Malaysia. They are still collating data to be shared, and I think the awareness campaigns and patient outreach is continuing. In Singapore, it all started with the Rare Disorder Society in Singapore, and on top of that, what happened next was to actually collect data from the various patient groups, various patients, families, and put it out there to for further engagement with the Ministry of Health. That allowed for the Rare Disease Fund to be established as well. And the next step will be actually working on a enabling master plan for rare disease in Singapore. So what seems to be the issue here in Asia or ASEAN is, one, there is very strong cultural dominance in Asia. So while we can have the strategy and tactics, they're usually really the tip of the iceberg. The culture is the hidden and the most powerful force from, that really pushes and drives change. So we've had an opportunity to work with the countries individually according to their own growth perspective, their own cultures, and to actually suggest changes at many, many levels. So the sustained change then would actually include a strategy, tactics, as well as the culture. Now, what we need to define then would be a multi-stakeholder plan for each country. Who remain the experts, who focus on the tactics, who are the achievers, who focus on the strategy, and the catalysts who focus on the culture, vision, and breakthrough culture. That would most of the time rely and stay with the patient organization. So now, how did we advance work? How do we move it then? I think through all the impact studies, through all the data collected, what was clear to us is the patients wanted these 8 points very clearly. They wanted to have medical advancements, policy changes, database of conditions to speed up diagnosis, improve coordination in psychosocial support, respite care and medical care, greater public awareness and acceptance of the disease, timely access to accurate information about the disease, more financial, emotional, and social support, more support from community, family, and friends. So let me take you to 2 steps that we have taken. One is Singapore, and this is the family of Kenneth Ma and Chloe here as Pompey. So Singapore established the Rare Disease Fund in 2019. It covers a handful of diseases right now, and I think this is the first major step for ASEAN in rare disease front. So, but at this point of time, we are still progressing, and we are looking at 3 key areas to take forward. The inclusion of more rare diseases in the listing under the Rare Disease Fund, data collation for the rare disease enabling plan that looks beyond treatment, because what we realize is we must be quite clear as to include the families that are not included and those that are without the therapy as well. And third would be more engagement with regulatory authorities to actually improve the quality of life and to actually work down the burden of disease for these patients as well. The next step will be looking at Thailand, and for a huge start, they had 24 rare diseases included in universal coverage, but they were very clear to also understand that there are challenges. And the 4 key areas they've identified for progress will be to gain public attention on rare diseases, driving policy with data, evidence-based, patient empowerment, and to improve the regulatory systems, not far from Singapore. So if you can look at that, 2019 in Singapore, 2020 in Thailand. So with all of the work and having had a chance to work with many of these groups in these countries over the last 5 to 10 years, I think what was quite clear to us is where are we moving and how do we bridge the gap? The first point would be change, bring about change with evidence, building a multi-stakeholder partnership model, standardizing treatment protocol, medication cost, diagnostic ability, and funding capability, educate and empower patients and their families of their treatment options, distinguishing between rare disease with a therapy and those without, 6 creative funding models to be explored this date and time, from things like outcome-based rebates, conditional reimbursement, private-public partnership funding models. So with that, I'd like to thank you for the opportunity, and I end my presentation here. Thank you, Hannah.
Thank you so much for that, Raj. That was really interesting. And I thought it was really interesting when you're talking about the cultural differences and the importance in that. I think in our Africa session yesterday, we were also really discussing the importance of like this multi-stakeholder approach. So it's just interesting to see the similarities between the two regions and the importance of respecting these different cultures and finding a way to drive progress, but bring everyone with you. So thank you so much for that. And I'm sure we'll have...
I think it's a very important point, because while we look at Asia and Asia Pacific as one, but actually we're very divergent when, if you look at India, and having worked with India as well, so I think that's a very key note, very important note for us to actually keep in mind when we deal with rare diseases as well. Thanks, Hannah.
Yeah, absolutely. Thank you so much again. And we hopefully will have some questions for Raj, which we can get to at the end. But up next, I'm really happy to introduce Swapna Roopesh. She's the head of strategic partnerships for the Organization for Rare Diseases in India. So thank you so much for joining us, Swapna. I'm really excited to hear what you have to say.
Yeah. Hi, Hannah. Thank you so much. Thank you, everyone, for inviting us to at the International Rare Disease Showcase. Now, I am here to give you a bird's eye view on India's and ORDI's rare disease landscape, the rare disease journey. Raj has discussed many of the challenges, and more or less the challenges that Asia face, or be it Southeast Asia faces. It's everything, more or less everything is similar. And So India is a highly populous country with more than 1.3 billion people and 4,500 ethnic groups. Now, this is a country that speaks close to 300 languages. Naturally, in our country, due to very high inbreeding practices, India is a melting pot for genetic diversity. In fact, we may have an estimate of 1/5, right? 1/5 of global rare disease burden in our country. So considering India's population, an estimate of 70 million people might be affected by rare diseases in India as of today. Now, what we do not have is a proper RD prevalence data due to lack of epidemiological studies, a lack of proper research on data, and lack of the ability to track ultra rare diseases. But what we do have is a RD policy, national rare disease policy, which was announced in March 2021. Now, looking from the vantage point of India's rare disease landscape, you can see very clearly that we have huge opportunities in the area of rare disease diagnostics to tap the undiagnosed rare disease rare conditions. And also we have even bigger opportunity in the area of therapeutics when it considers to the rare diseases. Now, before I dive into ORDI's rare disease journey, I mean, that is what I was invited to tell about how ORDI progressed along with the rare diseases in India. So before I dive into ORDI's rare disease journey, let me give you a brief about Nidhi. Nidhi, not only is she India's first Pompe patient, but she is also an inspiration to many, including myself. Nidhi has been a prime contributor for rare disease awareness and rare disease advocacy. She has contributed extensively despite of her challenges. Now, Nidhi's parents, they underwent a diagnostic odyssey of 7 years, more than 7 years, in fact, visiting pillar to pillar from visiting over 45 consultants, and the child has undergone innumerable tests just to arrive at the right diagnosis. Now, Nidhi's parents, especially Mr. Prasanna Shirol, he felt the need to help other children, help other families who are affected by rare diseases. And so he first founded the Pompe Foundation in India. Later on, he established the LSDSS in India. Now, all these rare disease, individual disease-specific support groups, they existed either at the state level or at the city level. They were functioning either at the state level or the city level, but nothing was really happening at a national level. So, having India having realizing the need for having a national umbrella organization, ORDI was co-founded by Mr. Prasanna Shirul. Now we established, we started in the year 2013 with the aim to be a common voice for the rare disease community in India. And our main objective is to make people lives better, the people living with rare disease, their lives better, because they are facing a lot of challenges, like Raj mentioned, be it stigma, superstitious, blame game, especially women who give birth to rare disease children. So it's a lot to deal with. So our objective was to make their lives better, people living with rare diseases, and to reduce the inequalities that exist, to reduce the gaps that exist when it comes to diagnosis and treatment. So we focus on three core areas, that is rare disease awareness, advocacy, and patient support. Now we realize and we focus very hard on addressing the urgent and unmet needs, be it shattering the social prejudices that exist for rare diseases, or be it rare disease diagnosis, access to treatment, providing the right information, or progressing towards rare disease research and addressing challenges such as lack of rare disease data. So we work in all these core areas in Organization for Rare Diseases India. Now, our very first and very early milestone was, suggesting or rather proposing a rare disease definition based on peer review articles and based on expert opinions. We sat together and then we proposed that rare diseases should be defined something as 1 in 5,000. Now, we all know that rare disease definition varies from country to country. Now, but what happens when it starts differing within the country itself? Now, India, like the landscape, India is like many countries in itself, but that doesn't mean that we have a varied rare disease definition. We need a standard rare disease definition where everyone, even research people, medical people, everyone can rely on. So while we suggested something as 1 in 5,000, ICMR suggested it to be something that is fewer than 1 in 2,500. And in orphan drug, as per the clinical trial rules definition, the orphan drug was something that was intended to treat a condition that occurs in less than 5 lakh, affects less than 5 lakh persons in India. So we are hoping to arrive at a standard rare disease definition very soon. The second major milestone that we achieved was the rare disease helpline, which functions 24/7. Now, this rare disease helpline has helped us in streamlining many of the rare disease inquiries coming from across the nation very effectively. So we have been able to streamline all these inquiries at one place. That was the first major plus point. Also, this rare disease helpline serves as the first line of interface between patients, families, and the medical expertise. Now, if you see the numbers, in the year 2016, annually we received only 322 calls. However, if you see in the year 2021, the calls had risen almost 10-fold larger. And that is a great progress that we have made. Our second milestone is the Rare Disease Care Coordination Center. Our objective is to reduce, like I said earlier, to reduce the diagnostic odyssey and to fill in the treatment and management gaps. So a Rare Disease Care Coordination Center, the concept was incepted in a hub and spoke model. And the concept was incepted so that we could give better quality of life for patients and their families with minimal financial footprint, right? Since we do not have a good amount of financial support, we incepted this particular concept of RDCC. It's a unique concept, and we help patients in by helping them in diagnosis, expert medical advice, access to good treatment options, and we help them with management as well. We have our multiple stakeholders who work hand in hand with us, and we're very thankful to all of them to make the RDCC a very successful concept in India. As of today, we have 3 RDCCs functioning very effectively. We have 8 more in the pipeline, and we're hoping to have them very soon. Now, these are the pictures of our Bangalore RDCC, also our first RDCC. This was established in association with Indira Gandhi Institute of Child Health and the Center for Human Genetics, Bangalore. Now, this center was established in the year 2016. The center has a full-time patient coordinator and a full-time care coordinator and a nurse. Currently, over 80 patients are benefiting by taking their regular ERT, regular infusions, and we have benefited over 1,000 patients, and we have helped over 350 cases. We've helped to crack over 350 rare disease cases with the help of these RDCC. Now, if you look at the rare disease, at the RDCC's layout, you would see that we have customized it so well because we know all our patients. Some of our patients travel by overnight trains, by overnight buses to just arrive for their, fortnightly or weekly infusions. And we want them to be as comfortable as possible. Maybe they can attend their colleges, while taking their infusion, or the parents can just sit back and relax, read a book while having the infusion. So we have tried to make the ambience and the infrastructure as comfortable as possible for the patients and families. That is a prime objective. And this, as a result, our patients and families really look forward to their infusions in a positive way. And we are also very proud to say that our Bangalore RDCC is being listed as one among the 8 care of excellence in rare diseases in India by the National Rare Disease Policy. Now, that is a huge achievement for us. Now, we also focus on disease-specific clinics, and we would continue to do so. We would continue to come up with more disease-specific clinics in the future. In association with Bangalore Baptist Hospital, we set up the Pediatric Muscle and Nerve Clinic, which caters to children with neuromuscular disorders. Now, this center, apart from taking care, apart from genetic counseling and helping the parents, it also has advanced gene therapy, and it has pioneered in offering these gene therapy treatment to eligible patients through the Compassionate Access Program. Now, we understand that advocacy is a humongous task. It's a painstaking task, and it requires a lot of commitment, requires a lot of compassion, dedication, and mainly perseverance. So we have formed an expert advocacy committee with like-minded, passionate individuals, and this committee meets from time to time to discuss the various challenges that we face as of today, to track our progresses, and to also plan the way forward, to track our next progress on rare diseases. So here you can see the various clippings that shows the kind of impact that our advocacy committee was able to make in India. Now, so far, India has made great progress when it comes to achieving a good an optimistic regulatory framework that caters to rare disease clinical research. However, at ORDI, we focus, and we have increased our focus on encouraging more and more such rare disease research activities, which may include maybe diagnostics, therapeutics, drug discovery, drug development. Now, our next hope is to bring in global clinical trials to India. Less than 1.5% of global trials in the rare disease segment comes to India. So we're hoping that this number increases so that our patients, the people living in our country, have access to new, safe, and efficient treatment options. Now, these are some of our other activities that we do by bringing stakeholders together. We conduct rare disease camps, and we conduct CMEs. This is one of our major sessions that we conducted last year. It was exclusively for medical professionals and for medical students, for postdoctorate students, for researchers in the rare disease segment. This session was conducted by 52 mavens in genetic disorders. They are geographically located across the nation. And this particular session was conducted across 13 sessions. The series was conducted across 13 sessions. And 39 pressing topics in the rare disease segments were covered by this. It was a good holistic overview on rare diseases for especially those who are studying. These are our patient advocacy groups, without whose support we cannot do whatever progress we have been doing so far. We are also thankful to our global partners who have given us a platform to voice the Indian rare disease community from time to time. Now, for the lay public, what we do is we create a lot of disease-specific awareness across social media platforms. We know that many people are not aware of rare disease names. Sometimes people don't know what genetics is or a genetic disorder is, but we are working very hard to increase this awareness on rare diseases, like from simple awareness series like Do You Know series to the awareness specific disease specific awareness. We conduct these in social media from time to time. Now, our third and most important milestone is Race for 7. It is a major milestone that we have achieved when it comes to rare disease awareness, and it is India's largest flagship annual rare disease event that happens. Now, this is also one of the most sought after rare disease annual day event that is being held in India. If you see, in the year 2016, we started with a very few participants, while in over the years till today, if you see the count, more than 35,000 people have participated for the Race for 7. And that is a good amount of number, because these people go back and then post it on their social media or discuss it with their families, discuss it with their relatives, or come back to us when they have many more inquiries. And we also have these disease-specific bibs that we give. Every participant gets a unique rare disease bib. So he learns a rare disease names, not only while participating, he or she learns a particular rare disease name. And if you see the pre-pandemic number, we were able to conduct on the grounds, on the venues, we were able to conduct this particular Race for 7 in 20 plus locations. However, post-pandemic, we were able to integrate this particular Race for 7 virtually, which was a huge success. And I think Race for 7 was the only run, walk, ride event that was held with such a huge impact. We were able to tap in people who participated from more than 250 plus locations, because they gave them the feasibility to participate from their own apartments, start from their doorstep, or participate in their favorite ground or school. We had a virtual app through app system management, and we were able to do this very successfully, and we're very happy with what has happened with the Race for 7 last year. So what we do is we announce pre-event, we announce through our social media once the Rare Disease Day event is coming. We call in our directors, genetic experts, and our sponsors, patients, caregivers, everyone, and we announce it kind of to the whole nation that Race for 7 is coming. We also conduct social media drives that we are very particular in one thing. We just don't want to attract a lot of sympathy for rare diseases. Rather, we would be happy if people built empathy when it comes to rare diseases. So we've been very strong in that stand. So what we do is we spread a lot of hope, and we also spread a lot of gratitude through patients. And we also thank the government from time to time for their continuous support. And that is something that we do to spread positivity in the rare disease segment across India. We also use celebrity support for influencing rare disease awareness, which is very important. We understand the impact that a celebrity has on the crowd. So we conduct programs and events where celebrity comes in and talks about rare diseases, and the impact is larger usually. And we also understand that the more regional voices we have across the nation, so we try to get celebrities from across the nation so that regionally they are able to make a larger amount of impact. Now, this is a very important step for us. We have worked very hard towards drawing the nations and policymakers' attention towards rare diseases, and we were able to do by key policymakers, key parliament members participating in our rare disease awareness drives. These are glimpses from the annual rare disease event that we have. These are very inspirational pictures. This is a flag off by Mr. Karthikeyan, who's an international Formula 1 racer. And so post-event, what we do is once the rare disease event is done, we make sure that it is announced across the nation, and it goes across the nation in, in various languages, so that people understand that something, and since most of our people who don't visit social media, for them this newspaper is a good platform. So we share what was done, what is rare disease, why this rare disease awareness was done, and why is it important, to break stigmas which is associated with rare diseases. So here we try to touch the society with the help of our media releases. Now, in a nutshell, this is our rare disease advocacy journey. If you see, before 2014, we were active from this time, but we were doing it at a smaller level. However, between 2014 and 2017, we did a lot of focus on a lot of action plans, along with our stakeholders. We did conferences, CMEs, like you saw earlier, and we established rare disease camps wherein patients would come and, share their questions and queries, resource centers. And all these action of ours, all these perseverance of ours over the years has helped us in achieving and moving close to the National Rare Disease Policy draft. Now, this National Rare Disease Policy draft, the first discussions was initiated in Karnataka, the state that ORDI is located in. And ORDI was a key member in the Rare Disease Policy draft. And we also, we also did judicial interventions so that the policy is speed tracked. And finally, by March 2021, we have a RD policy. Now, RD policy is not a foolproof policy which is catering to the broader population. However, it is a policy. There is a policy, and it is definitely going to benefit many, many people. This is the recognitions that we did, that we achieved over the years. ORDI was nominated to 2019 and 2020 twice by the business line, Hindu Business Line, for the Changemaker Awards. Our co-founder and executive director, Mr. Prasanna Shirol, is a Ashoka Award, Ashoka Fellow, and he also received the Rare Champion of Hope Award in the year 2019. Now, this is our, as we are approaching closer to our event, Rare Diseases Day event. This is the event that we're going to be held. It's going to be held on Sunday, 27th February 2022. And we are going global with the help of our international partners, Rare Disease International and Global Genes. And participation is available for international participants as well. We have a lot of work to do. Like as Raj mentioned, the challenges are plenty, and the progress and the planning to be done for the future, what we have done is very, very less when compared to the existing challenges. But we are hoping to continue our journey optimistically, touching more lives, improving more lives, and making a difference at a larger level. And we would also like to thank our patients, families, caregivers, doctors, volunteers, and all our sponsors who have helped us through and through this journey, helping us to, streamline our rare disease advocacy. We are very thankful to them. And I also thank the International Rare Disease Showcase for giving us this opportunity. Thank you.
Thank you so much, Swapna. I really enjoyed hearing about all the amazing progress you've been making in such a large and diverse country. It's just so impressive. And thank you so much for agreeing to speak with us today. And everyone that's watching, make sure you're putting your questions for Swapna in the chat, as we will be bringing everyone back at the end for some questions. So just keep adding them in there. But thank you so much, Swapna.
Thank you, Hannah.
Could you just quickly stop sharing your screen?
Yeah.
Awesome. And up next, I have Sue. I'm happy to introduce Sue White. She's a clinical geneticist from the Murdoch Children's Institute in Australia, and she will be discussing their Rare Disease Now program and their work bridging the gap to diagnosis and treatment. So, hi, Sue.
Thanks, Hannah. Swapna, do you mind just stopping sharing? That'd be great. Thank you.
Sharing. I have stopped sharing.
Yeah, got it now. Thank you so much. It's lovely to join you all to talk a little bit about a topic that we're clearly all passionate about is improving the lives of families impacted by rare disease. So I'm a clinical geneticist. I work in Melbourne at the Royal Children's Hospital, and this is a picture of my institute here. And I lead a project which is really looking at trying to improve really all aspects of rare disease care across the campus. So a bit more of a single snapshot from me today, but it's wonderful to hear the context more globally across the Asia Pacific. So at least in Australia, generally speaking, particularly in pediatrics, we have pretty widespread access now to clinical genomic testing, and that, of course, is transforming our capacity to diagnose individuals with rare disease. So that's been a super exciting development. And for me as a doctor working in genetics, it's changed what I can offer most families who come to my clinic with a child with a suspected genetic condition. So I guess what's the problem then? I guess the problem really relates to the fact that we're still seeing a huge burden of individuals with rare disease, more than 5,000 children seen for rare disease diagnosis on the campus at which I work. And it's still taking 5 to 10 years for those individuals to reach a diagnosis. We know that many families will suffer a misdiagnosis along the way, leading to misinformation, sometimes false hope, or sometimes news that just was not accurate for their affected individual. And despite the advances in genomics, some of the children we see never get a diagnosis. And of course, even when a diagnosis is made, that's not the end of the story. We would like to be able to impact the course of the condition, but only a small percentage of diagnosed individuals have approved treatment or trial options. So I guess we're excited to have genomic testing having a big impact on the way we diagnose individuals with suspected rare disease, but that only gets us halfway. We only get a diagnosis in half the individuals that we test. And so if we don't know the cause, it's kind of obvious, but we can't enroll that individual in any natural history studies. We can't connect them with other families with the same rare disease so that they can benefit from sharing their story and learning about other individuals' experiences. They can't access clinical trials, and I guess they might miss out on new opportunities to reach a diagnosis. And that's where our program comes in, trying to tackle some of the obstacles for families after they have the standard diagnostic testing and are still undiagnosed. So one of the things that certainly struck me as staggering when I looked at our mapping exercise, which this is a graphic of, this is a mapping exercise trying to look at the activity, rare disease research activity on our campus. So our campus is a clinical children's hospital co-located with a research institute, and you can see all the different, it's a bit of a solar system there of all the different teams who are doing rare disease research, largely speaking in silos without much cross-pollination or cross-communication. So our team, we have a vision of trying to enable all people with a rare disease to receive a precise diagnosis, optimal care, and access to innovative research and available treatment. And we see the sort of key pillars of that being new gene discoveries, engaging across our campus and beyond, so that we link clinicians, researchers, consumers, and international consortia, and taking what we learn and translating that so that all individuals can receive equitable access to the systems that we develop. So I'm just going to take you through 3 goals that we have and a little bit of progress on those. So the project's been running for about 18 months, and it was preceded by a pilot project where we were taking children who were attending our genetics clinic who did not have a diagnosis after standard genomic testing and offering them additional research genomic testing. So our first goal within our project is to really expand access of that so that across our entire campus, which sees patients from all around the state of Victoria and Australia, can access research genomic testing. So our pilot project took just under 100 families and offered them additional genomic sequencing, and we were able to get a diagnosis in just under half of those families. 17 of those families had a novel gene, had a DNA change in a novel gene, which was subsequently worked up and published. So that was exciting, sort of toe in the water kind of experience for us, but just really whetted our appetite to want to be able to give more families the opportunity. So we don't want just the families coming to the genetics clinic to have access to this type of testing. We want to bring other families who are seeing other units across our hospital and deliver diagnoses to more children. I work within a research institute that has a diagnostic genomics lab, so they provide diagnostic genomics to clinicians and families across several states of Australia and also into Southeast Asia. So we have good access to genomic testing, but we are now increasing our capacity to offer RNA sequencing, and also with collaborators at Melbourne University, proteomic sequencing. And that's really allowing us to try and maximise our diagnostic yield for families who remain unsolved after we do trio genome sequencing. So this is just 2 stories of 2 families, pseudonyms and not the family photographs here, just for confidentiality purposes. But the first is a boy who was referred to us from our neurology colleagues with a really disabling condition that was causing him nocturnal pain. And the fact he and his father have this same condition, very stereotypic episodes, and they had genomic sequencing with no diagnosis made. We were able to find quite a tricky little change in a gene that's known to cause a familial pain syndrome, and there is a specific treatment for that condition, and it doesn't take away Oliver's pain condition, but it's substantially improved his quality of life. This family were 2 siblings who were both born with a very similar pattern of problems, including unsteadiness and learning disabilities and a small head. And we were able to identify a novel disease gene in that family, and we've been able to publish that. Our second goal is really to engage and collaborate, and this, of course, is across our campus and with our relevant consumer groups. So we're fortunate to have quite active consumer engagement committee who give us input into our project. Obviously, we work alongside rare disease researchers at MCRI, and we want to share the learning that we're making. Critical links, I think, which perhaps haven't, at least on our campus, been developed as much as they could be and could be facilitated even more, are links with trial centres. So ensuring that individuals who have ultra rare genetic conditions are able to access trials when pharmaceutical companies and others come knocking with those opportunities. We are very keen to upskill our paediatrician colleagues in genomics, and so we fund pediatricians to come and work within our rare disease project to upskill in genomics, which has been a really successful venture. And we are part of national and international consortia, including IPCHIP, which is a consortia between some of the pediatric hospitals across the world to try and share learning and also, I guess, use the power of those organisations to drive change in rare disease care. So these are some of the organisations with whom we collaborate through our rare disease project. Our last goal is to look at bottlenecks to rare disease care, and these are really boring and frustrating, which I guess is why they still exist, but they are critical to improving the care of individuals with rare disease. So they things like taking genomic data from a clinical laboratory and getting it safely and accurately into a research database where researchers can analyse that readily, doing that in a timely fashion. That is a complex task. A huge challenge, I think, is improving identification of individuals with rare disease so that they can be linked into natural history studies and clinical trials, particularly around registries. That's a big challenge for us that we're working on. And so I guess this is just a bit of a graphic looking at all the different partners and our team and what we try to do, and some of the goals that we have, that we are working on: dynamic consent, integration with our electronic medical record, having a universal research ID so all those different research groups can utilise that, improving data transfer and sharing. We've talked a bit about some of our genomic analysis strategies and working at that treatment end on improving access to rare disease registries and trials and our international collaborations. So what does this mean actually for families? I think it opens up pathways for them to research after standard care doesn't give them an answer. It develops systems to collect and connect families with the same rare disease. And it means we can start to take opportunities for families to participate in natural history registries and clinical trials. We align with the National Action Plan, which is an Australian initiative led by Rare Voices, the advocacy group in Australia for rare disease. And that's been a really informative action plan for us to make sure that we are aligning with the goals of stakeholders as we proceed with our research. And I'll draw things to a close and thank all of the individuals involved, the families, clinicians and researchers. Thank you.
Hi, Sue. Thank you so much for that and showing the work you do. And I think it's so important to look at genomic testing and how and its role in reducing the diagnostic odyssey, which is such a problem for rare disease patients across the globe. And I think it's so important to highlight these centres where you're making a change and doing this more, and then this can hopefully be used as a model for other centres in other countries to also go ahead and continue to help patients the way you're doing. So thanks again, Sue. That was really great, really interesting presentation. Up next, we have Lisa Foster. She's the Chief Executive of Rare Disorders New Zealand, and she's going to be speaking about the landscape in New Zealand and the work that they're doing. So hi, Lisa. Thank you so much for joining us.
Hi, great to be here. I'll just start sharing my screen. So hopefully everybody can see that sharing of the screen.
Yeah.
Cool. Okay, so Morena, that's good morning from the place that I'm based, which is New Zealand, and it's actually good evening for me. So it's quite late over here, and that's because we're on the other side of the earth, of course. So I'm going to talk today about the landscape of rare disease in New Zealand and tell you a little bit more about what's going on over here. So the points that we're going to look at are just the situation in New Zealand. I'm originally from England, from Newcastle, hence the accent, but I've lived in New Zealand for about 16 years. So we're going to have a look at the rare disease situation in New Zealand, highlighting some of the positives that are happening over here around equity for the Indigenous people or Maori population. Talk about the advocacy, which has been vital and is still vital, looking at policy change, and then the hopes that we have for the future. So we are on the other side of the earth, as I said, and sometimes it feels that way when it comes to policy and equity for rare disease, to be fair. So how do we compare to the UK when it comes to rare disease equity? So unfortunately, the picture's not brilliant, and we have the feeling that we've been left behind without any definition or any policy or even recognition in this country, despite evidence and advocacy that's been in place for 20 years. We are currently in a time of change, so there is a big change at the moment, a big health reform that is being undertaken in New Zealand. This is called a once-in-a-lifetime health reform, and therefore it's really important that we have some moves for recognition for the 300,000 people who will potentially be living with a rare disease in this country. Within that health reform, there is a new Ministry of Disability being established, and they have made a statement that disability is not related to health, which is difficult when it comes to rare disease, of course. There is also a Maori Health Action Plan. So that's the Indigenous people have their action plan based on their ideals and their philosophies and their own model. And we can talk a little bit more about that in a second. And then there's also the global unity that we have, which is fantastic and very needed for advocacy and change in New Zealand. So how have we come to the point for this new health reform? We have to go back to 1840 to explain why that is. So there was a Treaty of Waitangi, and this is now known as Te Tiriti o Waitangi. And the issue for that is because there were two languages that were offered, so in English and in Maori, and the two versions were different. So the Maori chiefs who signed the agreement were expecting to have sovereignty over their rights, and the English version actually gave governance of their rights. And those two things have been disputed in the courts, and things have been going on for quite a while around equity and the rights of how things can be made to be more equitable for this population. So the Te Tiriti offered protection, rights and benefits to Maori as British subjects, and it declared obligations around participation, partnership and protection. And unfortunately, those things were not upheld, and there are quite a few arguments and basically issues around bringing that to court at the moment. So the Maori Health Action Plan, this is from 2020 to 2025. This is looking at our Ministry of Health, who are known as the kaitiaki, or the steward of the health and disability system, and explaining that they have the responsibility to enable Maori to have their own authority over their own health and well-being. So by Maori, for Maori, and to achieve equitable health outcomes in a way that allow the Indigenous people to thrive and flourish. Unfortunately, because of the issues of colonization and the way things happened in New Zealand, the health situation is quite negative and dire for the Maori population at this time. So how are things going to change? So the new legislation that is being proposed is going through a legislation council at the moment, and is known as Healthy Futures Bill, or PAIORA. And what it is proposing is that there will be 2 different authorities. So there'll be a Health New Zealand, and they will run the health system for New Zealand in partnership with a new Maori health authority to be established. So this will change the current system, which is lots of district health boards across the country that will be disestablished, and then it will be more nationally and progressively formed from 2 entities. So it is quite complicated, but it all sounds positive. But what about inclusion for people with rare diseases across all ethnicities? So we feel like there's lots of mixed messages. And what we tend to be told is, you know, we're a small country, we have 5 million people, and, you know, we can't be expected to help everyone. And yet we are a wealthy country and a progressive country, and one that is known throughout the world for human rights, including the first country in the world to give women the vote. So why are we leaving people behind when it comes to rare disease? So some of the things we've been discussing with our politicians are the community of scale that has a rare disease in New Zealand. If there's 5 people, family members who are affected, then that would equate to 1/3 of our population. So that's not a small population number, but they are dispersed, and they are not as strong a voice at this point as they could be. So that is part of our advocacy that we're working on. The other point that we make is that we all trust our government to provide equitable access to health and social care. And yet, if it is not being offered for a vulnerable population, you know, that actually is not acceptable. And an indifference that is sometimes shown is not an option. So what's the piglet in the room? I don't have an elephant, but I do have a piglet. So there is an issue that I feel is the barrier to progress and potentially the problem for recognition for us. Then it's rare disease medicine cost. So obviously this is a global issue. There are high prices for innovative medicines, and there are barriers towards getting access to these medicines in New Zealand that have been highlighted in the press and even at the level of the United Nations. So we are continuing to have a review of our medicine buying agency, which is known as PharmAC, and our interim report review has been very damning. It has explained that this is discriminatory towards Maori, Pacific, and people with rare disease in access, in the fact that they do not get access to modern medicines. And then also that there's no orphan medicine fund or policy. So the review has shown that PharmAC is underperforming and has not been able to address these inequities, and that there is also a focus on cost at the expense of societal cost or social or psychological cost. And that keeps coming up time and time again. The decision making is definitely not transparent and is very slow. So that also is a difficulty for the pharmaceutical companies who feel that there is not a clear pathway around the application process or around the outcome of the application process. So this convoluted procurement process and lack of transparency is causing a barrier to progress in receiving modern medicines for the people who live in this country. And many are choosing to leave New Zealand and go to Australia or back to England if they come from England. And we are falling behind other developed countries. So how do we feel? Well, keep calm and keep on keeping on. That's really the way we have to do things. So this Tuesday, I was speaking at a Legislative Council meeting, and we were able to express the opinions that we have with evidence from a survey that we've just completed, and also to show the relevance of reducing the barrier for the people of New Zealand who are living with a rare disease in order to take the pressure off our health system, given that we have Omicron who has just arrived on our shores. And surely that would be something that would be a sensible thing to do. So what other advocacy are we involved in other than public and oral submissions? We basically would like to raise awareness with the public around media. So we have opportunities to have stories brought through in the media. The political awareness is right up to our Minister of Health and also to Jacinda Ardern. We did send through a Children's Day colouring competition to Jacinda. And she wrote back to say that she would like New Zealand to be the best place in the world to be a child. We also have clinical awareness opportunities where possible with our capacity, and obviously international awareness, hence being here. There is an MP liaison program, so we get all of the collective groups within our organisation. So we have about 125 different rare disorder groups within our collective, and all the leaders of those groups and members of those groups went to visit their local MP with a unified message and with a unified call for equity, inclusion and recognition. We have ongoing meetings with our Disability Rights Commissioner and lots of other high-level meetings, to be fair. And I am a member of our current highest education review advisory committee. So we had a petition at Parliament and we took that petition through to a Health Select Committee, where the Health Select Committee members made a statement that it seemed to be a good idea to have some progress in this area of rare disease and to start to look at a potential framework. But we really do not know if that's going to lead to any action or outcome at this point. But the obvious thing is we need visibility and we need recognition as a vulnerable population. At the moment, we don't have that. And until there's greater awareness or acknowledgement of the issues that are facing people with rare disease in New Zealand, we cannot hope for substantial action towards solutions. It's very piecemeal, it's very duplicating and very wasteful. We often highlight the benefits to the New Zealand economy and to society, to the politicians we speak to. And great listening to Sue's talk about genomics, because that's something we're just looking at connecting with. So I am connected through the Rare Voices Australia and also with GARD, which is a connection through Australia Genomics group. But in New Zealand, it's very early days for genomics and very early days for any action or authentic engagement. We still are at the very beginnings of that opportunity, but it's wonderful to see Australia making those strides and moving forward with their action plan and their framework. We, as I explained already, we have asked for a reduction in the impact on a delicate health system, using our survey results to give evidence-based facts and to show that there is a preventative element with access to care, treatment and support. So we do hold our leaders accountable. We went to visit our Minister of Health. This was a parent, Sue Haldane, who led our petition, and her daughter has 22q. And the chair of our board, who lives with a rare disorder himself. So we all spoke at length with our Minister of Health, and we were hoping that he had heard our call, but that was in March, and we have had no outcome from that. So what would success look like to us? Success would be an agreement by the government in New Zealand to recognise people with rare disease as a public health priority. Be a nice start to recognise them as a population, and it would be wonderful to have a definition, which is something I heard earlier too. There would be also good for our legislation, given that it is once in a lifetime, that it would include rare disease at this stage. Otherwise, we're going to have to continue feeling like we're fighting rather than we're being included in these discussions. So the fact that we're all in this together and we are a global community of scale is very heartening and very important to the people that I represent. They need the support from the community of scale, from the global community, and we look forward to Rare Disease Day in order to have that sense of connection. You know, we may be on the other side of the earth, but we have the same challenges and needs and desires and hopes. And with that hope, the United Nations resolution, which was successfully passed on the 16th of December, is a real fantastic outcome for us, especially. And I think that we can look at ways to leverage and to use that to our advantage to explain that these expectations are not something that can be brushed aside and they need to be acknowledged. So with that, we have, I feel, a powerful and inspirational voice. This was an event which we have each year, and this year there were 18 craft breweries going to make some beer, some rare beer. The last year's winner was a fish beer, but unfortunately, Omicron has cancelled most events in New Zealand. Our own Prime Minister has actually had to go into isolation and everybody's just poised waiting. So we had to cancel or postpone this event, but keep an eye open because, you know, maybe we can get some beer sent over. And I'm sure there'll be some really exciting entries this year. And with that, I'd just like to say thank you so much. You know, all of the work that everyone does across the world and for the Asia Pacific region, our collaborations and connections, just they're so important. And I do get hope from the idea that each country is really given that little push by watching what the other countries are doing in the region and also being held accountable by their neighbours and by their global collaborators through the United Nations. So thank you very much.
Hi, Lisa. Thank you so much for that. I know you had a short video that you wanted us to play. Did you want us? Yeah, we'll go ahead and play that for you now.
Thank you.
Did you know having a rare disorder is not such a rare thing? In fact, 1 in 17 New Zealanders is affected by some kind of uncommon health condition. That's around 300,000 New Zealanders, along with their whānau who support them. Having an unusual health condition presents unique challenges, and it can be difficult to know where to turn for advice and support. That's where Rare Disorders New Zealand comes in. We're here to help. We know the system, we understand the challenges, and we understand that everyone's needs are unique. We help people living with a rare disorder and their whānau connect with support groups and information. And we advocate at the highest levels both domestically and internationally for the rights of the rare disorder community. We are the collective voice of all rare disorders in New Zealand, and we fight for a system to be fair for rare. In New Zealand, our health system has some way to go to match the support offered to rare disorder communities in other OECD countries. We understand where the gaps are and what needs to be done. And this is why our collective is calling for the development of a national rare disorder framework. It's time New Zealand realised that equitable health outcomes for everyone is the only way forward to make it fair for rare. Be rare aware. Learn more at www.raredisorders.org.nz.
Okay. Yeah, thanks for that again, Lisa. I thought that was so interesting because I think you wouldn't expect New Zealand to be in this place that they're at, considering they are such, you know, you're a wealthy country or in proximity to these other countries. It's definitely a surprise. So it was really interesting to learn about that and learn about the work you're doing to try and drive progress. But now I'd love to bring back all of the speakers and we can answer some of the questions that we've been getting. Hi, everyone. Just going to start with one of these questions in the chat. So I think this is quite a general one, but how do the vastly different political systems in this region affect the progress or the ability to make progress? Not sure if anyone wants to start off with that.
So, hi, Hannah.
Hi.
Yeah, thanks. So in India, health is a state subject and it is not a central subject. It is a little difficult to have disparities across the state. However, the best way forward would be to leverage the existing national rare disease policy and see what can be done best. So that is how we are working towards. And in future, we'll work towards having a better rare disease policy that addresses the challenges across the nation. So right now, yes, health is a state subject. So across the country, it varies.
Yeah, I think just to add to that, I think that we often use other countries, including the UK, as an exemplar to say, what is possible, and this is really useful. And I think for the Asia Pacific region, if we could have through APADO a bit more clarity about where the policies are and what stages they're at and what the benefits are and how far they've got through their policy settings and stages to get success, then maybe that's something that all countries could then leverage and use in an effective advocacy manner.
Okay, that's really interesting. Thank you. And so we talked a bit earlier about like research, and then this was mentioned in the APADO talk, and I think with Rajikanath as well. But how do you think you could bring, and Sue, you might have some input in this as well, how do you think we can bring more research and clinical trials into your region?
Well, I think research exists. I think what's good is we're collective. So I think we've had opportunities to work with Australia, even the government of Western Australia to actually work on how we can advance some of these things. So I think with research as well as, even clinical trials, rare disease is a multi-stakeholder approach. And I think that the clinicians are a group that we must always include for discussions on such topics as well. So it's not just patient-led. I think the patient advocacy group opens the door, but I think we need to bring in the other stakeholders to the table as well to say that, look, how can we facilitate some of these things? Because it's not just one driver situation. And sometimes when we speak amongst the stakeholders, the solutions are easily found amongst us. So that's what I've realized. I think with this region and what we're talking about between Singapore, Malaysia, Thailand, Indonesia, we've got very different political setups. Mm-hmm. But what I've noticed very closely is we learn from each other. And when Singapore came out with the Rare Disease Fund, so Thailand was also trying to understand how it worked, and so did Malaysia. But I think what we need to do is to figure out how such systems or schemes or policies may work well for you in your country and your political setup. So we need to tweak. So in our work with all of these countries, what we've learned is, I think it's great. We've learned a lot globally, but I think what we need to do is to try and customize those approaches to fit into our cultural system, something that does not scare our politicians off, where we bring them together on this journey to see that this is the big picture. This is the patient voice, these are their needs, and this is what we can do together. So I think we take a very community-based approach with the citizens' voice as well.
Yeah, thank you. Sorry, Lisa.
Just very, very quickly. I think with Duhan, her explanation about the region and how 2/3 of the population with rare disease are in the Asia Pacific region, and all of the benefits that offers around access for clinical trial opportunities. Again, I think it's that collaborative, connected effort and bringing people together. And I think we're at the very early steps and stages of that. And so it's quite an exciting phase to be in, where we have a lot of opportunity, I think, ahead to learn and support and collaborate together.
Yeah, and it's that theme of just multi-stakeholder approach, which we have just found across all 3 days of this showcase, which I think is just shown time and time again how important it is. So thank you. We also have a question, also kind of related to like clinical trials, but this is another huge topic, like about data. So you guys have got huge populations, especially like in the more of the Asia region. Are there like projects or plans that are happening to try and explore like real world data or gather more data that is so valuable for these patients?
Yeah, I mean, I can give the negative version of that. Unfortunately, yeah, we're not collecting any data as such that I'm aware of. So we have some innovative opportunities around data. We have a HERO project, which is looking at a persona. So we do have a lot of opportunity to collect data. And then I think we just need the policy change in order to add rare disease to that data collection for New Zealand. But we are quite advanced in our technology and our opportunity, our innovative emerging technologies. So they have a persona that they have created. And one of these personas I have managed to create and get them to look at rare disease as a persona to see how complicated and difficult their health journey is. And that persona is an image or an avatar to show the journey they go through around using, having to explain themselves time and time again to different clinicians and go across borders and have to repeat it again or carry information in a bag with them rather than actually having it electronically, those kind of difficulties. But again, I think New Zealand has a bit of a way to go. So, yeah.
Yeah, I think I agree. Data is so big, right? But I think how much data is enough? Or is data just too much? So we need to figure out how we want to use it, what we need to crunch it for as well. Because I think the big data is such a big term, but I think what we're doing is using it in bite sizes so that it can meet its objective as well. Because with rare diseases, we're not just going in one direction. There are many forms. I mean, there's psychosocial, there's financing, there's accessibility, clinical trials. So we need to figure out which stakeholder to engage with for the correct kind of data, who's going to use it, who's going to lead it. And, with HTA, there are two parts to data as well. You've got the patient perspective, you've got the socio-economic perspective. So these things need to be mapped out very clearly and carefully as well, whether it meets its objective. Yeah,
absolutely. And Swapna, I saw that you've got a feed.
Yeah. So in India, we have the ICMR, that is Indian ICMR. And ICMR is working towards a registry, where, like I mentioned earlier in my presentation. It is using the support of various stakeholders like the patient advocacy groups, and even ORDI is contributing very well in the area of data. It is going to be difficult because right now a lot of data research and evidence-based research, epidemiological studies are on the way. But yes, we are hoping to be optimistic about acquiring data. Yes.
And Sue, did you have something to add?
Yeah, I just thought I'd comment specifically about genomic data. One of the challenges that we experience with a fairly multicultural community in Australia is that the quality of population genomic data really varies from one ethnicity to another, and some of the countries within our Asia Pacific region are really poorly represented in population genomic databases. And so our genomic tests don't perform as well for those individuals from that ethnicity because we haven't got enough information to understand the background natural variation in their DNA. And so I know that the Centre for Population Genomics at the Garvan Institute are leading a project really trying to look at some of, as a first step, some of the ethnicities of migrants in Australia to, I guess, start to fill some of those gaps. And of course, for us, including Indigenous Australians who are very poorly represented in any genomic sequencing data. I think it's one of many data challenges, but it's one that I experience where I can see that the ethnicity of a family to some degree influences the power of the tests I've got to offer them and my ability to help them. So it's something that'd be great to try and address.
So yeah, if I can add something there. So in New Zealand, there is a project called the Variome Project with Dr. Stephen Robertson, who's actually on our board. So it's a 5-year project looking at mapping the Maori genome and having that information as a background in order to be more equitable when you're looking at genomic tests for that Indigenous population. So that's started. And we also have a project where we're doing some mapping or some genomic analysis with the Luminous support for some Maori families at the moment as well. So there's small, real pockets of excellence that are happening. So, I mean, I think that's where the collaboration and the connection and the benefit comes from, is the knowledge of all of these things that are happening. So there's so much going on. And then just around patient registries, it is something we've looked at here. But it would be, and it kind of, the idea comes from the Maori Genome Project, really from the Variome Project, that the patient owns their data. The person whose DNA it is, they own their DNA, they own their information. And even on a blockchain kind of system, they decide who they share that with and when they share it with them. And we call it taonga, which is treasure. So it's almost like your treasure is your information, and therefore you make the decision who to share with and when. And it might be a researcher, or it might be for some natural history study for research, or it might be another patient group, or So, but I think they're giving the power back to the person with the disorder. So that's sort of the way I would see things developing, and being hopeful about that in New Zealand.
Yeah, absolutely. And it's like the idea of like empowered patients and self-advocacy and like patient-owned data is such a huge topic. And I'm hoping we will see more progress in that going forward. We have another question that's just come through. So having a good inclusive policy is a great first step. We also need effective implementation to translate these guidelines into action. Any thoughts on how individual patients and patient groups can drive these efforts?
Well, I think patient groups are the key focus. I mean, if you looked at the discussion over the last couple of days, the needle has moved because of the many patient advocacy groups, whether it's APADO, whether it's ORDI, whether it's LISA, and whether it's even, Beacon, because I think that's what drives the momentum. That is the need, that is the purpose. And I think that what we need to do is to professionalize them, make sure that they're capable of doing it, give them, that training, the empowerment, that slot, that whole communications package, and they take it off because they are the ones with the story. I think Lisa just mentioned it. That's what we call patient empowerment, and that's where we actually start. So yeah.
Yeah, no, 100% agree with that. And I think we're looking at it very closely at the moment because we're at this sort of tipping point, really, I feel. So we have very clear messaging, a real kind of close connection with our group leaders, where as much as possible, because things seem to move at pace at the moment. And then opportunities for people to come together, even if it has to be virtually. But I think it's really important, the mental health side of this as well, which is something that we have not been able to get into because we feel like we're always pushing and fighting. But I think if we could take a breath and actually look at, resilience and other aspects around the mental health part of having to continue fighting for something while you also have to deal with a challenge and barrier of a system that doesn't quite work. And I think that would be something that I would be really keen to offer as a group, as an advocacy group and a peak body.
Yeah, absolutely. Swapna, did you have something to add on that? Just one last point before we close the session.
So I think Lisa and Raj, they have almost covered the points that I was about to mention. Empowering patients, because most of our patient advocates that are located across India, they are either parents whose child suffer from a rare disease, and or they are either patients. So the passion that they have, the drive that they have, that is very difficult to pass it on to someone else, someone who's not affected by a rare disease. So that in that case, we have to really educate them about rare diseases and show them the kind of impact that a rare disease has on a family. So it is really the patient advocacy groups and patients, families, they're actually very driven, and they make sure that implementation happens once the policy is out.
Absolutely.
Yeah.
Oh, sorry, Lisa.
Yeah. Oh, it's just working together. I think it's that unified collective voice, and with that becomes strength, that can't be ignored. And just to explain, we chose the word disorder because people preferred that to disease, and they actually didn't like, the politicians have argued, some politicians have said that the word rare doesn't help. But I said, well, I can't really change the word rare just because they're like, well, rare means it doesn't happen very often. Yeah, it's like, well, you can work it out. Yeah.
All right, well, we've come to the end of this session. Come to the end of the session. I just want to say a massive thank you to all of our speakers today. It was really interesting and great to hear from you all. So thank you so much for joining, and thanks everyone for watching today. This morning, it's lovely to see you, and I hope we see you for the rest of our showcase. So today's the last day. We have our next session. It starts at 10 a.m. So make sure to tune into that. There was a slight mistake on one of the graphics, I think, that said 10:30, but everything else is correct, and it will start at 10 a.m. So yeah, thanks again, everyone, and enjoy the rest of your day.
Thank you, Hannah.
Thanks.
Have a great day.
Thank you.